Hi, welcome to Living Healthy, where we are here to help you make sense of a nonsensical healthcare world. I'm Dr. Barton Bishop, the Chief Clinical Officer of Sport and Spine Rehab, and with us as always is Dr. Jay Greenstein, the CEO and founder of Sport and Spine Rehab. So this is part 2 of our mini-series on healthcare reform and the Affordable Care Act, also known as Obamacare. Last month we had our distinguished guests, Kirill Reznick, the Maryland delegate from the 39th District, and Hadley Heath, the senior policy analyst from the Independent Women's Forum, join us, and they're back again. And we're going to continue on this fascinating discussion to help you understand a little bit more about healthcare reform and specifically how you can make a difference in your life and live a healthier and happier life. So welcome back again, guys.
Thank you.
Yeah. So Hadley, the Independent Women's Forum, can you tell us a little bit about that and your role there?
Yes, we are a free market women's organization. I'm a policy analyst there with a focus on healthcare and a focus on some other economic and budget-related issues. We believe that women and men and their families are better served by solutions from the marketplace, solutions driven by free enterprise, limited government, and personal responsibility. And we think that'll result in those happier and healthier lives that you mentioned.
Sounds great. Well, thank you. So last month we had a great discussion, and we ended on discussing about the benefits to an employer, the benefits to an employee, to a consumer in accessing this healthcare and accessing the exchange and really getting having access to insurance that they may not have had elsewise. And Hadley, you talked a little bit about the system that we have in healthcare in the United States and how it's really it's not like any other system. So can you go into a little bit more about that system and what kind of things maybe are the real problems there?
Right. We have a cost problem, and some of the biggest drivers of our costs have to do with the fact that our incentive structure is messed up. Individual patients and consumers don't necessarily pay directly for the treatments and the care and services that we receive. We use a third party most of the time. Most Americans have some form of health insurance. In fact, most Americans get their health insurance through their employer. And we talked about that a little bit last time, some of the benefits of that kind of system, but there's also a downside to an employer-based system. For one thing, people's options are severely restricted when their employer is selecting maybe a handful, maybe less, maybe 1 or 2 plans to offer and say, do you want family coverage or do you want independent coverage for yourself? If those are the only options in front of folks, then there's significantly less competition, significantly less choices for individuals. We have other restrictions on the marketplace as well. For example, you can only buy a health insurance policy that's sold in your state. You can't go across state lines to buy a health insurance from someone else. We also have mandated coverage, and in every state there's some sort of coverage mandate. This is also true at the federal level now because of Obamacare. But if there are coverage mandates, then that means even if you want a plan that's more catastrophic in nature, that maybe has a higher deductible or less coverage, many times people don't have that kind of option. It would mean a more affordable premium for folks, but of course there would be a difference in coverage. So if I were in charge and if I could reform the system overnight, I would repeal Obamacare, and I would support reforms that put patients and individual consumers at the center of the system and give them the opportunity to choose among a more competitive marketplace.
So I love the idea of empowering the consumer and the patient because I think it's really important. They have to take responsibility for their health, and if they're paying out of pocket, they're going to be a lot more conscious about not going to McDonald's 3 times a week or sitting on the couch and eating bonbons, right? But at the end of the day, the way the price structure is today, if they go to the hospital, even if it's not catastrophic, but they're just sick and they go to the hospital and they have to pay $300 for an aspirin, or they have to pay an exorbitant amount just for that visit, I mean, how are they supposed to do that? I mean, I get the idea of
Right.
like that free market economy and consumer driven, but I mean the way the pricing structure is, at least in the hospital systems, I mean it's so expensive. So how do they do that?
Right. Well, I think this change would have to be driven by individuals making choices that they see as beneficial or valuable to themselves. So, of course, even if I waved my wand and reformed some of these long-term policies that have been at the federal and state level driving up our costs and driving up the level of government intervention in our healthcare system, it would not happen overnight that the entire provider and payment system would be turned on its head and magically we would have free or very affordable health care. But it would be a change, I think, that would start slowly to evolve into our healthcare system of individuals working together with their doctors. We already see this in some clinics. I don't know if you've heard of the Surgery Center of Oklahoma. There are some clinics where the doctors don't even accept insurance anymore. They only do payments from individuals, and they can offer a menu of prices for what they're about to offer. So one of the problems, of course, with individuals paying for their health care today is we don't know how much it's going to cost. We go in McDonald's and order a hamburger, we see on the menu exactly how much it's going to cost. But if we walk in a hospital or we walk in a health clinic, usually we don't know how much that service is going to cost because it's going to be billed to someone other than ourselves, or it's going to be billed through someone else. So having that kind of price transparency would also have to be a part of a competitive system.
So Kirill, we talked last time at the end of the show, and you talked about the benefits of people having coverage so they can go to the doctor, take advantage of preventative wellness services, and really work on being healthy. So what's your response to Hadley?
Well, here's the thing, and I am very much for a free market. Like I said last month, when I'm not in the legislature, I work in the private sector. My job is to work in the free market and sell services in the free market. But the reality that we have to face is that not every free market is exactly the same. We compare going into McDonald's versus Burger King. We know what we're getting. We compare getting a cell phone from Sprint versus a cell phone from AT&T. We know what we're getting. We can compare. We can make a reasonable and educated comparison. We can't do the same thing. If I have a heart attack, I can't tell the ambulance, give me a price from Suburban Hospital for this care versus Montgomery General. I can't do that. I'm having a heart attack, and I'm going to go to the closest hospital that's to me. That is not a system that is availing itself to a free market price comparison or even a free market services comparison. I don't know which hospital is better for treating my coronary. I don't know. So we have to have a system in some ways that is a little more equitable than simply saying it's entirely on the individual to make that choice. Because the individual person is not educated enough to be able to make a choice between medical providers or medical facilities. They're just not. And I don't think that putting that pressure on them, especially in times during catastrophic care or even less than catastrophic, but emergency care, in times of those kinds of events is even fair to say. We have a system through a third party that is done to be able to mitigate that kind of decision-making process because the education factor is just simply not there and can't be unless you go get a medical degree.
Well, I think our patients in our fields, we really try to educate them. Right? Sure. We try to make sure that they understand what is happening in their health, what's happening in their life, what's happening in their condition. And more people are more and more educated about their condition. Google, right? And we have a problem with this where people become overeducated because they come in with headaches and they think they have malignant brain tumors, and they think that their world is ending tomorrow. And so, in some sense,
WebMD is both a blessing.
Yes, exactly. In some sense, by the way, Google Scholar gets you scholarly articles a little bit better than Google. But Google.com/scholar. So there's a problem where they're sometimes too educated and they don't know enough. And I agree with you completely on this idea of I'm having a heart attack, I can't choose. But what if I sprained my ankle playing soccer last night? Should I go to this hospital where the average bill is $10,000 because I'm going to get a CT scan and an X-ray and an evaluation by 7 specialists, and then I'm going to have a hernia repair as well because that was the cause? Or can I go to this emergency care center or what have you that the average bill is only $500? Why can't that happen? Like, why doesn't that exist?
I think what we're talking about, again, is not the heart attack, but I'm sitting at home and my ankle is swelling up. You don't know you don't know what you need, first of all. I mean, I don't know if I need just an X-ray or if I really do need the CT. I don't know. I don't know if a splint is enough, or we can't compare the services in that way. You need to go to a medical professional that you trust, and you need to be able to pay that medical professional in some way. Now, one of the things that we're finding is one of the issues with the exorbitant rates that are increasing is the fact that insurance companies haven't been paying out as much as they should have been. We know that insurance companies have been using the system to manipulate the reimbursement rate, and I apologize, I'm not going to call it a reimbursement rate.
Yeah.
The payment rates to doctors,
Yeah.
you're not getting your money back for a trip to a conference. You're actually getting paid for services. The payment system to doctors has been manipulated. The system for what is and isn't covered has been manipulated by the insurance companies. And in fact, we're now finding out that the amount of money, the cost to benefit ratio that hasn't been paid out into the way that they should be, which is something that the Affordable Care Act fixes. Once we have more money going from the insurance companies to the doctors for payment for these services rather than being left for profit to shareholders, we're going to start to see some of this change.
Well, I want to get into the insurance companies a little bit, but I just have one follow-up on that, because the insurance companies, that we have our battles with the insurance companies. There's no question.
Sure.
It's a really kind of nightmarish. But specifically, as it relates to this cost thing, and you want to go to a provider you can trust, one of the things I see, and I'd like your thoughts on this, Hadley, is specifically the medical legal aspect of the cost. Montgomery County has many distinctions. It's a wonderful county, and I love calling it my home. It also happens to be the county with the most attorneys per capita of anywhere in the country. And what we have, and that's not a bad thing, but it is a thing. And so when you go to a hospital from a car accident, we see people all the time that have very simple neck pain. And they leave the hospital after riding over there in the ambulance with an x-ray, with a brain CT, with maybe even a neck CT, with evaluations by orthopedic surgeons, neurologists, high-level painkillers, a neck collar, all of this stuff when they had whiplash. And whiplash is managed very simply. And that cost, I have to think, is partially borne by fear.
Right. There's a lot of issues that touch on healthcare and our healthcare costs and why it's so expensive. The cost of practicing medicine, regardless of what level provider you are, you had to get training. A lot of people leave that training with significant student loans. We need reform of our student loan system. And then when you enter the marketplace, which can hardly be called a marketplace given how messed up the payment system is, when you enter the healthcare system, then you do face these high costs in terms of malpractice insurance, and the liability, just the practice of defensive medicine is certainly an issue. I go back to this terminology between marketplace and system, and that is the key, because comparing the healthcare market, there is no such thing in the United States. We can't compare it to the market for hamburgers. We could maybe make some comparison between what happens to us when our car breaks down. Maybe that's the most similar thing to having a heart attack or an ankle sprain. You may have to go to the closest shop where they can fix up your vehicle. But we don't use our auto insurance to pay for our oil change. We don't use our auto insurance to pay for our tune-up most of the time. If it's a catastrophe, then we use insurance. That's what we do in every other form of insurance. But using health insurance as simply a way to finance all of our healthcare costs results in a lot of bloat.
Yeah, I mean, there's so many topics. My head is literally spinning right now, but there's so many topics to touch on. But I really want to get back to the idea of the insurance companies and how they're addressing payments, because this also ties to access for patients. Mm-hmm. So if the doctor is not getting their payments because now the services potentially are being denied, patients can't get what they need. So I sit on 2 professional advisory committees for 2 different third-party administrators for major insurance companies in this country. And what I'm constantly hearing at these meetings is reduced access. Mm-hmm. And what I'm constantly seeing on the Wall Street Journal is increased profits. And so no matter what happens with Obamacare, if we don't get some level of equity and justice for patients to access the services that they're paying for, either through their employer or in the marketplace, this problem will never get resolved because people won't use the system. Right. Or the marketplace because it costs too much.
Sure. In a free and competitive market, usually profits indicate a good thing. They indicate that the industry is able to provide valuable services at a low cost. But in the healthcare system, what we do not have is a competitive or free market. We have a system where there's huge demand. Most people want health insurance. And now that we have Obamacare, everyone is mandated to buy health insurance. So everyone is mandated into the market. There's no free entry or exit in this system. And I think that the high profitability of some health insurers sort of indicates a lack of competition. There's no way for consumers to hold these insurers accountable for the kind of care, the kind of reimbursement they do on our behalf, the kind of information they provide for us, or the cost in terms of our premiums. So if we had more competition in the system, if we had a true marketplace, then consumers would be empowered to say, I don't like the way you're treating me, I'm going to go to another provider, another carrier.
Great stuff. So we're going to take a break. We'll be right back, and we're going to talk about a very important issue, quality. We'll be right back. Thanks.
The smallest moments can have the biggest impact on a child's life.
Ready or not, here I come.
Take time to be a dad today.
Daddy, I'm gonna find you.
Welcome back to Living Healthy. So at the end of the previous section, we talking about innovation. And this is one of the biggest parts of healthcare reform that does not reach media enough, and therefore you. So let's talk about specifically, Kirill, what did the Affordable Care Act, what did it institute in terms of innovation and improving quality for the patient?
Well, as I mentioned before, one of the best ways to improve quality is to actually get people, while they're still healthy, into their doctor's offices. Once you have insurance coverage, you're able to do that. And the way that we expanded through the Healthcare Reform Act, the type of insurance that you can get. So, kids can now be on their parents' insurance up until age 26. So they get out of college, they may or may not have a job after college. They're still able to access that health insurance. As they're getting into their mid to later 20s, they may not feel so invincible after all. Getting the pre-existing condition requirements off of insurance, getting anybody who actually needs health care to get health care as part of the process for being able to get insurance. Those were huge steps in being able to get people into their doctor's offices so they can have those conversations. And it's conversations that don't just deal with, my leg hurts or I can't sleep, but it's conversations about, what are you eating? What does your diet look like? How much exercise are you getting? Are you smoking? Are you drinking? Are you doing drugs? These kinds of conversations that people aren't having with medical professionals, especially in areas where the access to care has been minimal. Rural areas, urban areas. We in the suburbs, we do pretty well. But in the extremes, there has been a limited amount of access. The other thing that's been done as sort of a parallel to the Affordable Care Act is the idea of electronic medical records. And this is something that Maryland has been pushing, has been an innovator on in terms of adopting an electronic medical record system to be able to reduce some of the redundancy that you had mentioned earlier. Some of it, yes, it is defensive medicine, but some of it is just redundant. You go to one doctor, he does exams, the medical records never transfer. You go to a different doctor, they do the same exams, and they're all expensive exams. So being able to access medical records through a secure, privacy-driven, but system that can be accessed by multiple medical professionals to be able to actually continue that quality of care. That will be a huge step in making sure that people continue to get healthier.
And what has not been done to improve quality?
Well,
what related?
Right. One of the concerns that I think Obamacare critics have as it relates to healthcare quality is that, as you've mentioned before, Barton, this is really a law about health insurance. And having a health insurance card or a health insurance certificate doesn't necessarily guarantee you that quality time with your doctor that Kirill was talking about. And what the law actually does is, while it does expand access for health insurance, perhaps through some kind of expansion of Medicaid, more people will have an official document that says, or they're on the books as being insured, but that's not necessarily giving them the same kind of quality time with a physician. We have to recognize that in this country we're going to have a physician crisis. We're going to have a shortage in the number of healthcare providers who are able to spend that time with their patients. And with the crunch on reimbursements, especially if a doctor or a healthcare provider is trying to see patients on Medicare or Medicaid that have even lower reimbursement rates, then there's an incentive for providers to spend less time with their patients having those important conversations, and there may be longer wait times for people as well. So ultimately, if you can't get a doctor's appointment, what value is it to have health insurance? I mean, it will help you when you end up in the emergency room, but that's not where we want people to end up.
So in that market-driven model that you have been talking about, how do you fix that? Because you still have people that, let's say, can't afford their insurance coverage, or it's going to be hard to get into a doctor. The physician shortage is the physician shortage. How do you address that problem?
Well, in a market-driven system where practicing medicine is profitable and where people have more options in terms of the kinds of health care they receive, then I think more people, right now with the system we have and with Obamacare, we have physicians answering surveys telling, I would not encourage my children to become physicians. And that's sad. That's sad in America, that one of our most esteemed professions, where people can help people become well when they're sick. What an amazing profession, that people are actually not encouraging the next generation to get involved. So I think we need serious reform that would focus on the provider side, that would focus on the affordability element of this, and not just on quote-unquote access, which really just means having a piece of paper that says you're insured.
That's great.
I was going to say, one of the things that we need to remember is that the vast majority of the Affordable Care Act has not been implemented yet. The exchanges are set. They're ready to, at least in Maryland, they're ready to be up and running. They're about ready to start enrolling people. But the Affordable Care Act has not really kicked in, with the exception of a few things. Kids under 26, pre-existing conditions, a couple of other things. So to say that, we have an access problem and people are not encouraging their kids to go into the medical profession because of Obamacare is really kind of a fallacy, because we haven't seen the effects of Obamacare. Now, do we have and have we had a doctor shortage? Absolutely. This is especially true in primary care. This is also true with regard to things like reimbursements and payment to medical professionals for general surgeons and a couple of other specific professions. But the reality is that we haven't seen the effect of more people having insurance on whether or not that will expand or decrease the amount of doctors in the marketplace.
Sure.
The other thing that we've been doing, and this is something that is really regulated at the state level, but we in Maryland have been encouraging other medical professionals outside of just MDs. I mean, we have chiropractors and physical therapists, but we have other medical professionals that can definitely take up the slack. One thing that we have recently done in Maryland is we've expanded the ability of nurse practitioners to take on primary care roles, leaving doctors to do more complicated, see patients with more complicated issues and afford them more time. Nurse practitioners can take up that slack. Physician assistants can take up a lot of that slack. One thing that I know you guys are interested in and concerned about is federal legislation that's been proposed by Congressman Harris from Maryland's 1st District about limiting the ability of certain non-MDs to be able to do work that is currently done by MDs.
And currently under their scope of practice.
And currently under their scope of practice, absolutely. Not only is this an issue that has been traditionally left to the states to regulate, which is something that we do on our committee all the time, but it's going to completely limit the ability to expand that pool of services to other medical professionals who are trained and equally able to do the same quality of care.
I find the idea of repealing, it's called Section 2706, I find the idea of repealing that so disgusting, because patients access so many different providers in the system. Mm-hmm. Massage therapy, acupuncture, physical therapy, chiropractic. The MDs don't run the world, right? And so patients need access, especially the evidence-based services, access to the evidence-based services that are helping them every single day. So tied to that, and knowing that Maryland is a leader with the Health Information Exchange and all that's going on with CRISP, which is another acronym, how can we ensure that all healthcare providers that are taking care of patients are actually part of that Health Information Exchange? We
need to obviously expand the pool of the insurance companies being able to include more medical professionals in their network.
Healthcare providers.
Healthcare providers, absolutely. And medical includes all healthcare. One of the things that we have in the state of Maryland is the ability to say, and I think this is probably universal, is that if you are a licensed medical professional with a license that's recognized by the state, you are able to access insurance. And so you are able to be a provider under a particular network. And so in Maryland, we have not just MDs being able to provide through insurance networks, but chiropractors and physical therapists and nurse practitioners and physician assistants and all kinds of different non-MD medical professions or healthcare professions are able to get that access, to be able to be part of those networks. The more people you have in an insurance network, it's going to work the exact same way. the more choices you have. Right now we have Care First is sort of the 800-pound gorilla in Maryland. It covers about 80% of the Maryland market. But we do have other options, and the Insurance Exchange will have 7 or 8 total health insurance providers that will be accessed on a number of different plans. So each insurance company will have multiple plans that will fit you, and you'll be able to compare those.
Something I've never understood. Why can't I buy health insurance like I buy car insurance or life insurance or property insurance or anything along those lines? Why do we have to go through these group employer-sponsored plans essentially? Why can't I work for a company and buy a plan from my native state of Nebraska if I want?
Well, the reality is this has a lot to do with history in the United States. Around the time of World War II, when people were coming back into the workforce, there were still some wage controls in place, and the wage controls limited employers' ability to raise wages, believe it or not. Today, most wage regulations force a minimum wage or force a wage increase, but the opposite was true at that time, and so employers lobbied and asked if they could have health insurance benefits be something they could offer as part of compensation without paying taxes on the money that they use to buy health insurance. So that's why most people in the United States have employer-sponsored health insurance, because these decades and decades old regulations, regulatory laws are in place that give a tax advantage to people who buy health insurance through their employers. You could, I'm sure, Barton, go onto the individual market and buy some kind of health insurance for you and your family. Kirill mentioned earlier that not everyone can do that because before Obamacare, there were some real exclusions and some real hurdles to access for people with pre-existing conditions. That's a serious problem and something that definitely needed reform. I don't think it merited all of the reforms in the 2,700 pages of the Affordable Care Act. There are better ways to provide options for those people. But ultimately, you can do it. You just have to pay for your individual health insurance with your post-tax dollars.
Yeah. If you remember the debate that was going on during the debate over this bill, and the outcry that occurred when people thought that their employer-provided insurance is somehow at risk. You're absolutely correct. This is an issue of tradition. This is an issue of just how we've been doing things for 80 years and maybe a little less, 60 years, and people just have always known this to be the way that we've done it. And when we went to change the system, the outcry that occurred was so deafening that so much of the bill had to be scaled back. The original concept of the Affordable Care Act is not what got implemented. Through the legislative process, many, many things were scaled back. I think we probably would have been a lot better off if some of those things didn't get cut away. And honestly, and I hate to politicize it a little bit, but I am a politician. So, if all members of Congress were willing to work with the president in actually putting a system together that worked, I think we would have gotten a much better product. This is not a product that I would have been entirely happy with. I like a lot of it. But at the end of the day, it was a political system that was done for political purposes. And unfortunately, we got a scaled-back version of what we should have gotten.
Well, and there's, Kirill's right. You can change the system in more than one way. And to move away from employer-sponsored insurance as the main source of insurance in the United States, I think would be a good move. But you can do it with a carrot or you can do it with a stick. And the Affordable Care Act definitely does it with a stick. It does it with a lot of mandates, a lot of penalties for employers who don't comply, but yet the penalties are more affordable than the health insurance will be.
Thanks for being here. We really enjoyed having you. We enjoyed having you guys. We'll see you next month on Living Healthy.